After the doctors called off the December 2011 strike last year, the return to work formula that was signed between the doctors and the government, among other things, had promised that they would pay registrars working in Kenyatta National Hospital, Mathari and Moi Teaching and Referral Hospitals.
Solidarity forever.
8 months down the line, registrars or trainee doctors have downed their tools for breach of a return-to-work formula by the government.
8 months since signing of the return-to-work formula, registrars are still slaving in our major training institutions, working without pay. Postgraduate fees for doctors is yet to be paid, and this put in jeopardy the training of specialist doctors, which the country is in dire need of.
Through the Kenya Medical Practitioners and Dentists Union KPMDU, the doctors insisted that the government has enslaved them through intimidation and threats.
The ones who are still under the government-sponsored training are actually bonded for 3 years after they finish their training, that they must work for the government. They do not have a choice of basically resigning and going into private practice. Because if they do that, then they have to pay back the government more than 3 million shillings as the cost for the bond.
The union is alleging that although the government fulfilled some of the proposals in the Musimi Task Force report, other key issues remain untouched.
The report on the subcommittee on registrars, which will provide a copy that proposed the payment of a stipend of 92,000 Kenya shillings backdated to December 2011, must be implemented before we can get back to work. Number two, the postgraduate fees that was allocated and is missing must be accounted for by the responsible officers in the ministries of health.
Self-sponsored registrars have gone out of their way to say, look, I am ready to pay my own fees. I am ready to cater for my own training. All I am asking is that my training entails work, and for that reason, you should pay me for services rendered. There is no postgraduate training that can take place without working.
The principal of the School of Medicine in the University of Nairobi declined to comment much, saying that the institution is in talks with key stakeholders in the government concerning the issue.
Institutional machinery is in consultation with the relevant ministries to address the matter that are of concern to our doctors. And secondly, that the partnerships between the university and the Kenyatta are going to endeavor that we reduce the suffering of patients.
Operations at Kenyatta National Hospital remained unaffected though, since consultant doctors are on their stations. When signing the return-to-work formula last year, the government, among other things, devoted to provide 20 million shillings for training. Post-colonial slavery, they have called it. But the truth is that such an industrial action will put the common mwananchi on the edge. And as civil servants choose the only language they think their government understands, shall we leave our mothers, our fathers and children to perish in negligence? Job Wesonga, GBS News.